Hey, Mike Averill here. I'm a therapist at the Pain Psychology Center where we treat chronic pain. This is an introductory video for group breath work for chronic pain sessions that I hold weekly. Okay? The first thing I'd like to go over is why you might even want to join one of these breathwork sessions. I want to make it really clear and set proper expectations. A breathwork session is not going to cure you of your chronic pain. Let me repeat that. A breathwork session is not going to cure you of your chronic pain. So why would you want to join? Two reasons. Number one, a weekly breathwork session, especially with other people and some accountability, it can give you a dedicated time and place to practice the perspectives that pain reprocessing therapy teaches us, okay? And these perspectives will be discussed a little later in the video and reinforced every single breathwork session, okay? So you don't actually need to be too aware of these, or you don't need to have them mastered before joining. Just know that this partially is a place to practice these perspectives, okay? That's the first reason. The second reason is breath is one of the very few things that straddles both the conscious and the subconscious mind, okay? We can intentionally change our breathing. You can think about it and change it conscious. And also, thankfully, it's subconscious. When we don't think about it, we still breathe, right? So in this sense, when we shift how we breathe, it shifts how our whole nervous system is operating. And sometimes one of the issues with chronic pain is rigidity in the nervous system. So breath work helps encourage our nervous system away from rigidity. Okay, so two things, two reasons, two purposes you might join breath work for chronic pain. One, gives you a dedicated time and place to practice the pain reprocessing perspectives. And two, it's an opportunity to encourage less rigidity in your nervous system. There are a few things that you should be aware of or should have done, especially if we've never worked one-on-one, but even if we have. All of these things should be addressed or thought of prior to joining your first breathwork session, okay? One, you should make sure that cyclic hyperventilation is safe for you. Ask your doctor, okay? Before you join one of these breathwork sessions, you need to make sure your doctor signs off and says that it is safe for you to engage in breathwork or cyclic hyperventilation, okay? Two, you need, and again, this is also with your doctor, so probably got to talk to your doctor before joining. You need to make sure there are no medical interventions or medical treatments that are required for your pain that you're ignoring. You need to make sure you're not ignoring any medical treatment that you need to be seeking out for your pain. Okay, for example, breathwork is not going to help an infection or a broken arm or something like that. That's medical treatment, and you got to go do that, okay? So before joining, please make sure there's not medical treatment you are ignoring or avoiding, all right? Thing three, please prepare. Think about, be ready. You don't have to do too much like homework, but be ready for you to be asked to practice accepting your pain during these breathwork sessions, okay? And we'll clarify what that means in the breathwork sessions and even maybe why a little bit, but be ready. That's going to be what's asked of you, is to be accepting, even if just a little bit, of your pain, okay? And the fourth thing that I really encourage you to be aware of before you join is just know, I get this question a lot, just know that you don't have to be in active pain to join the breathwork sessions. You can still get plenty out of these sessions, even if you're not actually experiencing your pain or your symptoms during the session, okay? The core way we are going to practice pain reprocessing therapy within these breathwork sessions is through what I will refer to as the 3-step process, okay? This process is going to be reviewed every single time during these breathwork sessions, okay? So I'm gonna go over them short and brief here, but you will get more of it if you join. 3-step process. The core of pain reprocessing therapy looks like this. Step 1, tell yourself, repeat to yourself, the sensation, the pain I am feeling right now is innocuous, okay? In other words, the sensation, the pain I am feeling right now is real and safe. Okay, so some iteration of, yes, this is a real sensation. However, it doesn't mean there is active tissue damage occurring right now. All right, so step 1, we're going to come up with a statement and we're going to repeat it. The pain I'm feeling right now is innocuous. Step 2, you're going to turn attention towards the pain and practice regulating. Practice staying calm as you welcome, as you open up, as you practice accepting the pain, okay? Step 3, you're going to turn attention towards some other sensation, neutral or positive, within the body, okay? And this is really important. Sometimes there's a sense of, oh, there are no other sensations, or that none of that is true, and it's very important that we practice connecting with and experiencing sensations that are not our pain, okay? So that's step 3. Little review, and again, reminder, we're gonna drill this in every single breathwork session. But step 1, repeating a statement to ourselves that reminds us that the pain we're feeling is innocuous. Step 2, turn attention towards the pain and regulate and calm the system. Step 3, turn attention towards some other sensation, neutral or positive, and practice accepting that as well, being open to that, letting that take over the experience. The 3 steps, okay? Okay, finally in this video, I'd like to go over the typical agenda of a breathwork session so you know what to expect, and then tell you how to prepare, what you will need to join one of these breathwork sessions, okay? Each session is about an hour long, planned for an hour. First 10 to 20 minutes, some questions, we settle in, and then through meditative approaches, we practice the 3 steps, okay? Reminder, step 1, we repeat to ourselves, the pain I'm feeling is innocuous. It is safe. It is also real, you know? We repeat that. Step 2, we turn attention towards the pain. We open to it, we welcome it, and we regulate. Step 3, we turn attention towards some other sensation, and we dive into that. We really feel that, okay? So first 10 to 15 minutes, we land, we settle in, and then we go over the 3 steps, okay? Next chunk, we do 5 to 7 minutes, and I should say, this next chunk of the session will include music. You will be listening to music, okay? 5 to 7 minutes, cyclic hyperventilation, a little bit like this. You're gonna breathe like that for 5 to 7 minutes. It's quite a lot. Sometimes we feel tingly, sometimes we feel emotional, sometimes there's all sorts of interesting experiences, all right? It is not permanent. 5 to 7 minutes, cyclic hyperventilation, big breaths in, big breaths out, okay? And then we will breathe out and hold the breath. And hold the breath as long as you can, while again, calming and regulating the system, okay? So 5 to 7 minutes of the cyclic hyperventilation, followed by a breath hold. That takes about 7 to 10 minutes. We will repeat that 3 times, okay? So this is the main breath work chunk of class. 5 to 7 minutes of breathing a lot, and then we breathe out, hold the breath. We repeat that 3 times, okay? And then after that main chunk, we'll sort of calm down, settle down, and then there will be room to ask questions and share about your experience. And that will take up the whole hour, okay? So again, review, there will be 10 to 20 minutes of settling in and going over these 3 pain reprocessing therapy steps, evidence-based steps, okay? Then the next chunk, 5 to 7 minutes of the hyperventilating, cyclic hyperventilating, followed by a breath hold. We do that 3 times. Okay, and then we have sort of a debrief, a come down, a land, and then ask questions section, all right? Now for each and every one of these breathwork sessions, I encourage you to have a place to lay down, a comfortable place to lay down. If it can be private, that's even better. 2, headphones. You'll want some headphones, okay? 3, blankets and pillows. These can be really, really nice during breathwork, all right? So just repeating that again one more time. You will need a comfortable place to lay down that is ideally private. 2, you will need headphones. I almost forgot to, but you'll need headphones. Listening to music makes it a little more private, makes it kind of helps us go inside. And then 3, pillows and blankets can be really supportive. All right, well, I welcome you to reach out to me prior to a session if you have any questions at all. You also don't need to, and I welcome you to just join a session and see what it's all about. With that being said, I hope you do join and look forward to seeing you in a breathwork session sometime in the future. Take care.